All right, let's dive right in. We're going to talk about something that happens at the very, very top of the professional ladder, and that's the unique mental health challenges that leaders face. If you're a CEO, a founder, a senior exec, you already know that the pressures you deal with are in a totally different league. So why is a specialized approach to therapy not just a nice idea, but actually critical? Does that hit home for you? I mean, you've built the career, you've hit all the numbers, but somewhere along the way, the weight of all that success started to feel, well, crushing. This isn't just some abstract feeling, it's a real paradox a lot of leaders live with, usually in silence. So let's unpack that paradox. The psychological pressures on executives, they're just fundamentally different from what most people in the workforce experience. It's not just more stress, it's a completely different kind of stress. Now, here's what's so interesting about these pressures. It's how they all pile on top of each other. You've got decision fatigue, right, from making hundreds of high-stakes choices, day in, day out. Then there's leadership isolation, because let's face it, the higher you climb, the fewer people you can actually be real with. Imposter syndrome that just gets louder the more successful you become. And chronic burnout that doesn't just affect you, it trickles down to your entire organization. Add in the hypervisibility, the stigma around ever looking weak, and then this last one, identity fusion, where any little setback at work feels like a total personal failure. The thing is, these aren't your failings. They are byproducts of the job itself. Just think about that for a second. A staggering 75% of CEOs say they've experienced imposter syndrome, that nagging feeling that they're about to be found out. So here's the key takeaway. That feeling of self-doubt, it doesn't shrink with success. Nope. It actually gets bigger, fueled by higher stakes and bigger expectations. You are definitely not alone in this. And it's not just imposter syndrome we're talking about. In 2024, 56% of leaders reported feeling burned out. But here's the difference. Unlike general workplace fatigue, when a leader is running on empty, the company's vision, the culture, every single team member feels it. It becomes a systemic problem. And this really grounds it in clinical reality. Executives are significantly more likely to experience symptoms of clinical depression. We're talking 26% compared to 18% in the general workforce. Research shows a measurable difference in distress levels, and the main cause is chronic stress from work. This isn't just feeling stressed out, it is a documented health gap. So if the problem is so obvious, why don't the standard solutions work? Well, the truth is, a lot of executives who do try to get support find that the usual mental health resources, they just aren't built for their world. This chart just lays it out so clearly. Generic approaches, they often create an insurance paper trail, which, for privacy reasons, is a complete non-starter. They tend to lack depth, using short-term employee assistance programs, and the knowledge is generalist. A specialized approach, on the other hand, guarantees complete privacy because it's private pay, it does deep, systemic work, the therapist actually understands organizational dynamics, and it works with an executive's insane schedule. Yeah, let's be really direct about the risks here. Using your insurance creates a permanent diagnosis record. Those EAP programs are often just a handful of sessions with counselors who just don't get the nuances of executive psychology. And that fear of being seen in a waiting room, that's a legitimate liability. So the bottom line is, most therapists simply aren't trained in the power structures and organizational dynamics that you have to navigate every single day. And this all leads us to the solution, a targeted approach. This isn't about finding just any therapist, it's about finding the right kind of therapist, a specialist who is fluent in the language of leadership. I love this analogy because it makes so much sense. When the stakes are this high, you don't go to a generalist. You go see a specialist who deeply, truly understands the complex system they're working with. Your mental and emotional health as a leader deserves that exact same level of specialized expertise. And let's be really clear about what we're actually treating here. Executive burnout isn't just regular burnout with a bigger paycheck. No, it's a clinically distinct condition. The stakes are higher, the isolation is deeper, and the road to recovery requires a therapist who understands organizational systems, not just individual symptoms. And this is exactly where that specialization comes in. You have practices, like CEREVITY, for example, that are built around this specific idea. Their clinicians are trained specifically in the psychology of leadership, of power, and all the unique dynamics that come with high-performance environments. Simply put, they get your world. Okay, let's talk in terms you use every day, return on investment. This is not an expense. This is a strategic investment in your single most critical asset, your own mind and your ability to lead.
And the returns here, they're tangible. We're talking about getting that clarity back in your strategic decisions. We're talking about the ability to maintain high performance in a sustainable way without burning out or self-destructing. And research from places like Harvard Business Review shows that when leaders manage their own mental health, their teams show way higher engagement and retention.
This chart from the World Health Organization makes the business case perfectly. For every $1 invested in treating conditions like depression and anxiety, you get a $4 return in better health and productivity. It is one of the best investments an organization or a leader can possibly make. Because let's be honest with ourselves, the cost of doing nothing is staggering. It shows up in bad strategic decisions that hurt the entire company, in the breakdown of your most important personal relationships, and in some very real, very severe physical health problems down the road. So if you're ready to stop just surviving and actually start leading with clarity again, what's the next step? Well, it's about taking direct, decisive action. Ultimately, it really all comes down to this one question. For high achievers like you, it's always about performance, about having that edge. And when burnout and stress start to dull that edge, it's time to do what it takes to get it back. You don't have to just keep white-knuckling it alone. If you're done with that and ready to actually talk to someone who gets your world, go to CEREVITY.com and book your first session.